Are achy legs keeping your child awake at night? He or she may have growing pains. Growing pains are cramping, achy muscle pains that some preschoolers and preteens feel in both their legs. The pain usually occurs in the late afternoon or evenings, but it may cause your child to wake up in the middle of the night. Growing pains usually start in early childhood around age 3 or 4. They tend to strike again in kids aged 8 to 12. Despite the name growing pains, there is no firm evidence that growing pains are linked to growth spurts. Instead, growing pains may simply be caused by muscle aches due to intense childhood activities that can wear your child's muscles out. These activities include running, jumping, and climbing. Growing pains seem to be more common after a kid has a particularly full day of sports. Sore muscles after physical activity, known as delayed onset muscle soreness, can occur when you start a new exercise, change your exercise routine, or increase the duration or intensity of your regular workout. When muscles are required to work harder than they're used to or in a different way, it is believed to cause microscopic damage to the muscle fibers, resulting in muscle soreness or stiffness. Growing pains are different for everyone. Some kids have a lot of pain, others do not. Most kids do not have pain every day. Growing pains can come and go. They may be experienced for months or even years. Most kids outgrow growing pains within a few years. The pain is usually felt in the late afternoon and evening, right before dinner time and at bedtime. The leg pains may hurt so much that they may wake your child from sleep. If your child seems perfectly fine in the morning, don't be quick to think he or she is faking. Growing pains disappear in the morning. They usually do not interfere with the child's ability to play sports or be active. In general, growing pains are felt in both legs, especially in the front of the thighs, back of legs, or behind the knees. Studies suggest that that children who have growing pains may be more sensitive to pain. A doctor can usually diagnose growing pains by examining your child and asking questions about his or her medical history and symptoms. It is important to rule out any other possible causes of the pain before making the diagnosis of growing pains. This is why it is important to see your doctor if you think your child has growing pains or any limb pain. Treatment of growing pains depends on how much pain your child has. The following things may ease discomfort and help your child feel better: massaging the legs, stretching the leg muscles, or placing a warm cloth and heating pad on the sore leg. If the pain does not get better, ask your healthcare provider if it's okay to give your child an over the counter medicine such as ibuprofen. Call your child's doctor or nurse if leg pain occurs with the following symptoms: injuries such as a fall, fever, loss of appetite, limping, rash, red, warm, painful, swollen joints, tiredness, weakness, and weight loss. Growing pains are often described as an ache or throb in the legs, often in the front of the thighs, the calves, or behind the knees. Growing pains tend to affect both legs and occur at night. They may even wake a child from sleep. Although these pains are called growing pains, there's no evidence that growth hurts.